Kim can give you an overview of her experience over the last year and a half. We have a brief PowerPoint presentation that we'll use to guide it, and then we'll take it from there. So Kim, I turn it over to you, and let me know when you'd like me to put up the PowerPoint.
Thank you, Rory.
Before I do, sorry, one more point. I'm sorry.
Okay.
This is every time I do this. One more thing. We're offering CLE for tonight's program. I will be reading the CLE attestation code. Every person who would like CLE, make sure that you put your email address in the chat on the side. We will record that, and then we will send you the CLE forms to be returned. But you must make sure that you note the CLE code when I read it during tonight's program. So thank you. Okay, and Kim, go ahead. Thanks.
Thank you. Thank you for having me. LERA, New York City LERA. My name is Kim Moore-Ward. As Rory said, I am the Deputy Chief People and Labor Relations Officer for the MTA, but particularly I represent New York City Transit. I just want to give a brief overview of the MTA for you. The Metropolitan Transit Authority has over 70,000 employees, and because we are a public transportation agency, the vast majority of our employees are public-facing frontline employees. Our employees are represented by 27 unions and 84 bargaining units. New York City Transit is 96.4% represented. We ran service throughout the pandemic, which created numerous challenges for all of our staff. So, as this was a rapidly evolving situation, we needed to develop different protocols on short notice while acting at the direction of federal, state, and local health authorities. We did our best to communicate with union leadership as well, but quite frankly, we made some decisions and decided to bargain the impact later if we needed to. And so I've also given you a timeline of some of the memos, policies that were issued in relation to the ongoing crisis and some of the decision points that needed to be made along the way. At the beginning of March is when COVID really hit. I went back, this process actually helped me put in a file of all the things that were done. And I think I probably left some things out too during this period. But beginning, the first document that I could find, beginning on March 6, 2020, it was regarding COVID-19 leave and exposure protocols. And also the triage procedure for suspected COVID-19 cases. These were instructive procedures to supervisors and managers on how to report employees who have exhibited flu-like symptoms. It helped us do some contact tracing. It helped us, determine who should not be coming back into the workplace. Of course, this was new to all of us, so it took a long time for people to become adapted to that. So it resulted in people being sent home, and we were faced with, we know about quarantining now, but we were faced with what to do about leave time. And ultimately we did come up with some policies and granted some administrative leave and had conversations with represented employees or representative unions about those kinds of things as well. On March 17th, we put out a COVID-19 guidelines for managers and supervisors. We established a 24/7 hotline to report cases so that, we could be aware. As I said, we kept running transportation during the whole pandemic. However, at the beginning stages, we know once people were sent home, our ridership was very close to none, but we nevertheless kept running transportation. So we had to have employees, right? We had to talk about availability. We need to know what those numbers were so that we could continue running some type of service. On 4/1/2020, we did a COVID-19 sick leave memo reporting on, we started reporting on the 3 new laws that were provided leave during COVID-19, EPSLA, EFMLA, and New York COVID-19 paid sick leave. We had to move quickly on those things. These were newly established. We had to get the information out to our, our union partners and try to discuss it with them and how this was going to be carried out, so it required a lot of communication. And in April of last year, we even did a vacation carryover, which was something that we did unilaterally. Although some of our collective bargaining units had collective bargaining agreements had provisions. But again, because we were concerned with employee availability, we gave a more generous vacation carryover than some of our union agreements allowed for. In March, in March of 20, the governor sent all office employees home. You know, this is when we were under complete quarantine. New York State was on lockdown. Our employees were home for a month before, in April, we actually did a COVID-19 emergency telework agreement. And what that was is that we not only did we have these agreements for our non-unionized workforce, our administrative workforce, but we also had some unionized administrative workforce. So we had to individually have agreements with our labor unions about what this would mean for employees not coming to work. Just laid out in simple forms what the expectations were. And once they signed off on it, those employees would stay home. We renewed these agreements as we were moving through the process. And as you know, now we're starting to talk about return to office. And you know, we're going to continue to have those conversations. You know, along the way, we've reissued administrative leave FAQs. Those rules changed a lot. We had to keep the communication going there. And in April also of 2020, we had additional administrative leave guidance because we had to put in interim health screening protocols, staggered shifts, group A and B rotations, et cetera. Later on that year in June, continuing the mandated telework return to work, at some point, we slowly started bringing people back to the office, social distancing. Again, AB, not more than 1/3 of us in the office at one time. We had to have people at the door monitoring our temperatures, all those kinds of things. And because we have folks in depots, in barns, in yards, we had to have conversations with the unions about how those things would be administered. What would happen if somebody registered a temperature that was higher than what was allowed? How would they go home? How many days would, were we going to pay for it? As, how much of their time were they going to use? All of those things were conversations that we had to have with the union. And then, additional COVID-19 related HR guidance as was needed. Additional agreements that we had, and I guess Rory and I will talk about these later, were COVID-19 death benefit. Of course, the extension of some contractual time limits, sick notes, doctor's notes, when people, administrative leave time, those types of things. We did a unilateral extension of some contractual time limits because of COVID, and trying to be honorable in the fact that we know that some things just could not be done during this time period. So we relaxed a lot of provisions that we would usually have. And right now we're in the process of having conversations with our labor partners about the return to office protocol. So that's just some of the things. It's been a long year and a half. We've had to turn on a dime. And Rory, you and I will now, I guess, have a conversation about some of these things. But I just want to reiterate that we did have conversations. We negotiated very little. I said at the beginning, some of the things we made a decision that we were going to have to implement quickly. And to the extent that we had to engage in impact bargaining afterwards, that's the decision points that we made along the way. Mostly the unions were understanding of that. Yes, there was some pushback, but on some elements, but for the most part, we were able to reach agreements on some of the things that we had to do because we had to move so quickly. So that's an overview of what the last year and a half has been like, Rory.
Wonderful. So, I'd like to talk now about some specific topics that we had discussed, Kim, and share with everyone else here how each of these specific topics was addressed. And since Elizabeth's not here, and since I do have some personal experience working for the nurses union, I'm just going to give a broad overview of some of those topics myself when we can pitch in. I should also note we should encourage a little more participation since we are without one of our speakers. So if anyone has any commentary, feel free to enter it into the chat. Any questions, feel free to enter those into the chat. It's about 35 of us, so if people want to speak up, if you can use the hand raise function, or if you just want to speak up, as long as we do it politely, I think we can manage it. So, so one of the first subjects, just because a lot of people here deal with this every day, and it's kind of the the, not to put it cynically, but like the bread and butter of our industry, and that it's something that we just have to deal with all the time, are disciplinary issues.
Mm-hmm.
We do a lot of arbitration cases, and I know a lot of those came to a halt. But how did your office address disciplinary issues that came up during the pandemic?
We quickly were able to figure out how to do disciplinary hearings via Zoom, right? Some of the, we lapsed some timelines, with agreements by the unions about, implementing the discipline or having to move to the next step at a certain timeline. We had conversations about that. And quite frankly, a lot of discipline just didn't happen, right? I think that we, as a society, we were more open to letting certain things go, for lack of a better word. But and some of the rules were relaxed. But one of the things that I did find that came out of this as a novel issue was that, and we had our own employees report when they felt other people were coming into the workplace sick, right? That they were putting other people at risk because they didn't want to use time, or they didn't want to acknowledge that they may or may not have COVID, or those kinds of things. Those are things that we had to address pretty quickly, and nothing real substantive came out of that, but those are some of the novel issues that came out of it, out of discipline. But in terms of going through the disciplinary process, we really didn't have a lot of hangups, because we figured out how to do what we needed to do virtually.
So I can tell you from the nursing industry, without naming any specific actors, I understand that there were some tacit agreements and there were some explicit agreements about what kind of discipline would be issued, what kind of discipline would be acted upon, and what kind of discipline would be forestalled, and how disciplinary meetings, as you said, would not take place for a certain period of time.
Mm-hmm.
I don't know that anywhere in the industry we actually ever ended up holding we held video arbitrations, but I don't think we ever ended up having. I just got a text from Elizabeth Baker who said she's joining in. She had a power failure.
Oh.
So she's in New Jersey, so she's welcome in NYC here, but I guess they have their own trials there. But in any event, because everybody had to be in the hospital physically, we ended up returning relatively early to having disciplinary hearings, but they were drastically reduced. And I do think that gave the people who issue discipline, the people who receive discipline, the people who represent people in disciplinary hearings, a different perspective on, I don't want to diminish it, but the importance and the urgency of disciplinary action in the greater scheme of our missions. I'd like to put it that way.
I think that's true, right? I think, and some of the, our time and attendance disciplines, those things that are around attendance and administrative, those drastically reduced because, we did things like suspended submissions of doctor's notes or extended administrative leave or, those types of things. So there was certainly one aspect of the discipline, which is the time and leave track for us, that was drastically reduced, right? So, and other issues, I think I have to go back and do, again, realize that our institution is so large that I probably don't have the statistics yet about what happened in this past year. So I wouldn't be able to tell you exactly how drastically it was reduced, but I would be able to say that disciplinary charges were probably reduced drastically here.
Well, so Kim, you were talking about time and leave and the reduction of discipline for time and leave issues. And time and leave kind of play hand in hand, especially in the nursing industry, for staffing issues, which
Yes.
also came up. And there was
Same here.
this constant push and pull about how to get people to come in, and how to make sure people weren't coming in sick, and where to allocate
The resources,
because staffing became a scarce resource. So can you talk
Yes.
a little bit about that while I try to get Elizabeth on?
Yeah, I mean, I touched a little bit upon it when in my introductory little thing there. Vacation carryover was one of the things that we implemented. We asked people to not take leave if they were well during this time, because we had those employee availability issues. That's one of the things. There were other, although we kept with service, we had to reduce service at some points. The people, were not working the same shifts that they were before. There were a lot of those things, and we're still, quite frankly, having availability issues now as we're ramping back up service. So those are, absolutely, it was a time and leave was a big part of it, and employee availability is still a big part of what's happening here.
So did you bargain, Kim, did you bargain in your industry? Did they bargain any incentive agreements or any kind of agreements to try to get people to come in? Any extra pay or anything like that?
No, we didn't do extra pay for returning to work, for coming to work. That was the thing that we did. Yeah, go ahead.
No, go ahead.
No, we didn't bargain extra pay, an extra pay incentive for coming into work.
So I can say in the nursing industry, we saw things that were all over the place. There were certain places where they issued incentive payment in the terms of an hourly wage for anyone to come in on any unit. They issued sometimes gradations of hourly increases for people to come in on more dangerous COVID units or to work in other units that weren't necessarily COVID affected, although it seemed like they all were at one point. Then there were recognition pay agreements that were effected after the fact to recognize the service that people conducted. And usually those agreements took the form of measuring the amount of someone's service during the period of time. And we spent a lot of time trying to figure out how to craft those and how to make them equitably, because think about you've got a situation where someone who works on a COVID floor in a hospital may contract COVID itself and therefore be unable to continue working, and then be disqualified from receiving COVID recognition pay that her coworker may receive because her coworker was lucky enough not to get COVID. And so there were all of these competing interests that we were trying to negotiate. So that was just one of the interesting aspects of the push and pull for staffing. Another concern that came up with staffing was making sure that people felt safe coming into work. And so I think it would be interesting to hear from you, Kim, how you navigated the health and safety protocols as they came down, both from the government and from the demands, frankly, of the staff.
Right. So, yes, that it's still a major concern as we have people returning to the office, right? So, PPE was, was the primary thing. I think, New York State produced its own hand sanitizers. We had it with all our employees, mask, all the protocols. There was at the beginning, the CDC had a different take on what should happen than the MTA did in terms of having all our employees wear masks and all that kind of stuff. We did.
And what was the difference there?
Well, at first the CDC wasn't recommending. If you remember, at first the CDC wasn't recommending mask, and I think maybe the first week we were trying to follow CDC protocols, and at some point we realized that that was not going to work for us, right? Just because our employees really wanted to wear masks, and we realized that maybe the CDC was wrong about that. So I think we moved out in front of the CDC for those protocols. And during the time of the whole pandemic, of course, we were trying to follow a lot of the federal state guidelines, and a lot of times New York State was ahead of the CDC and some of the things that they were recommending. So, it was really time consuming trying to follow what the new guidance was, because sometimes it was changing daily, weekly, whatever. And then we had to put out new guidelines, make sure that everybody knew what the guidelines were, make sure that everybody was following protocol. Some of those things, as I was talking about before, were the temperature checks and making sure that everybody's getting tested coming into the building. We asked people to do a self-check at home, a self-check protocol at home before they even left for the office. I mean, there was all those kinds of social distancing. Some areas had plexiglass in between stations. Again, in some of the depots and barnyards, it was very hard for people to have that social distancing, especially when they're checking in the morning, getting the equipment, going out into the field. So signage, people directing people. I mean, there were all kinds of interventions that had to be done to try to keep people safe while they're at work.
And did you accomplish these interventions? How were they accomplished with the
unions? With
unions.
labor.
What was the substance of the discussions and the nature of the discussions?
Right. I mean, the nature of the discussions were, and this I can remember the phone calls. Okay, Kim, the rules just changed again. What are we doing? Right. So here are the rules. This is, and I think a lot of it was, this is what we're thinking. Do you have any input? Because it was moving that fast, so it wasn't a lot of time for discussion. And at some point, I think early on, we realized that, I think both the unions and management realized that there's not a lot of time for discussion here. So I think management was trying to come to some fair way of doing it and presenting that to the union, so there wouldn't be a lot of back and forth on it, because we didn't have the time for back and forth. So again, it was a lot of, this is what we're doing, or this is what we think we should do. And if we have to impact bargain over something, we'll do that later. But right now we have to make this change because the law has said so, some guidance has said so, the governor has come out with some guidance, some whatever. So it was more of that. This was not labor relations as we know labor relations. We didn't have time to make decisions. So
so I can tell you from the nursing perspective, the union in some instances didn't have time to make decisions, but some of our members, made their own, some of you may have seen some of this, made some of their own decisions. Some of them crafted their own PPE and decided to take pictures of themselves to make sure that people knew what they were resorting to. There were instances where members would make demands for PPE, and if they didn't receive it, there would be, the management would have a very, very hard time finding the staff that they needed because people wouldn't be available, where the union just wasn't even involved because we didn't even have time to get a phone call because things were moving so quickly where many of our members were concerned about the adequacy of the CDC guidance. I mean, Kim, as you said, initially there was never any guidance that said in the healthcare facility that people shouldn't be wearing masks.
Right.
But even though people were wearing masks initially, I recall the guidance for N95s, which are the best masks you can have, was that somebody could reuse them or wash them. And that practice lasted in many hospitals, especially in non-union facilities, for a lot longer than I think it ought to have. And we, the union, were stepping in a lot of places after our members really getting active around the issue, and making sure that we were the priority for obtaining the actual PPE. Did you, Kim, have any role in the requisition? Did the organization have any role in the requisition of PPE, or any challenges facing?
Well, absolutely. I mean, we had to procure a lot of the PPE, right? And at first, as you say, Rory, there was a shortage at the beginning, right? And the N95s, I think the first instance we would give the field, the folks who are out in the field, they got an allotment of 5. And as you say, at first, they probably were not able to change them daily because it would be a little time before they can get another allotment of the 5 N95, right?
Right.
So that, yes, it was problematic at the beginning. At some point, though, we started, however, got more equipment. And we have, the other day I came into the office and I got this bag of masks and hand sanitizer.
We have props now.
Yeah, I got props, right? But I found this when I came into the office the other day, because we are starting the return to office process. So at some point we have probably more PPE than we need, but at the beginning it was scarce, and it was scarce for everybody because nobody had really gone through this. And then we were hearing, we needed to make sure that the healthcare folks got it first, right? Because you were in the hospitals and so on and so forth. But again, transportation here in New York City, the MTA never stopped running, and our folks, unfortunately, were getting sick and from this disease as well. So you're correct. At the beginning, there was a lot of, how are we going to do this? There's not enough. We have to give it to those people who are most susceptible to it, and people had to make decisions about how that PPE should be distributed.
And what about now? Do you have obviously there are guidelines for wearing PPE in the subway. I have to adhere to them, right? Everybody has to put on their mask in the subway now. But are there guidelines in other workspaces for mask wearing and social distancing?
Well, the governor has recently relaxed the guidelines here in New York State, but up until this week, when we come into the office, when we're in the building and not socially distanced, we're still wearing a mask. I'm at 2 Broadway right now, so I wear a mask when I leave my office if I'm going, to get on the elevator. I think some of the signage is changing now. The elevators were allowing 2 people, no more than 2 people at a time, so that we could be socially distanced. Some of this and the work areas, we actually moved chairs out of conference rooms so that people would not congregate in them. If any arbitrators here who've ever been here at 2 Broadway, we have an arbitration suite on the first floor, that wasn't being utilized during this whole time because, obviously we weren't having those type of meetings in person. So we are rapidly going back to some sort of normalcy. We're not quite there yet, but some of the rules are being relaxed.
All right, at this juncture, I'd like to read the CLE code and welcome Elizabeth Baker, who has arrived by phone. She is muted. She's the phone participant who's 917-579-4824. So Bernadette or Emily, if you could please unmute her. I don't think I have the ability to do that myself, or Elizabeth, if you can unmute yourself. I'd like to bring you on, but I would also like to read the CLE code. So the CLE code for tonight's program is EBG
Hi.
296. Hey, Elizabeth, that is EBG 296. And again, if you'd like CLE credit, please put your email address in the chat and I will send the forms to you. So, Elizabeth, we got through.
Hi.
Good evening. Oh, there you are. We can see you. Wonderful.
Oh,
So
well,
let me
it
get.
lasts, I seem to be going in and out, and my apologies. The latest in the year plus since the pandemic started.
The travails
in
continue.
New Jersey.
So let me give a brief introduction for those of you who don't know Elizabeth Baker. She's the Director of Bargaining and Employer Relations at SEIU Local 32BJ. She and I were colleagues there. 32BJ, as many of you know, is New York City and the United States' largest property service workers union. Represents residential doormen who were working during the pandemic, commercial office cleaners, most of whom were not working during the pandemic, security officers who were working, schools cleaners who were and were not working, airport workers, among many, many others. Elizabeth is currently on vacation, so I'd like to especially thank her for joining under those circumstances. And Elizabeth, since we're kind of pressed for time now, why don't you give us just a brief synopsis of your experiences you plan to do at the outset?
Sure, and thank you, Rory and Kim. Again, sorry for being late due to this power outage, which hit about 5:45 here in New Jersey. So I work with Local 32BJ's Greater New York Metro divisions from Hudson Valley through New York City out to Long Island. Local 32BJ has over 1,000 members in these geographies. And Rory, as you said, many sectors ranging from newly organized airport workers to residential and commercial workers to the cleaners in our Broadway theaters and other performing arts venues to publicly contracted security at major infrastructure sites and city sites. So when the pandemic hit, Local 32BJ's membership was hit very intensely. Our residential members and our security members, particularly those in the public shelters, were on the front lines as the city of New York was sheltering in place and COVID was spreading in apartment houses and shelters. Our commercial members were facing significant displacement due to building closures and layoffs. We had about 21,000 commercial cleaners. At one point, we had nearly 6,000 members who were laid off. There were many others who were working a reduced schedule, but their employers were able to keep them in full pay. And then in the theater cultural sector, that was the first sector that was impacted by the closures. Starting March 12th, all the performing arts venues throughout the city were closed. So we rapidly had to negotiate with the Broadway League as well as other major venues with respect to the effects of the shutdown. So I would say that we responded a couple of different ways. First of all, we worked through our major employer associations, including the Realty Advisory Board of Greater New York, which represents the major real estate owners, co-ops and condos on the residential side, and cleaning contractors, as well as security providers, to negotiate a series of memorandum of agreements which responded to the evolving emergency, dealing with the layoffs, dealing with accommodations for employees who weren't laid off but who were at risk based on pre-existing health conditions or other factors, such as a vulnerable person in their home who needed accommodations. We were dealing with, as Kim was describing, a shortage of PPE in the initial months and evolving guidance on PPE. And the need to continue health insurance for members who are being laid off. So with the Realty Advisory Board, we negotiated a series of memorandum of agreements, which are all on the 32BJ website under the contracts tab. We can send the link around if you'd like after tonight's session. That began on March 18th, and we're still in negotiations, with a current series of MOAs responding to the needs of the industry and our membership as we reopen. So in these memorandum of agreement, we arranged for a continuation of health insurance, which was eventually extended for 150 days from the date of layoff. We pioneered with the RAB participation in the New York State Shared Work Program, which helped blunt the impact of layoffs and kept several thousand members working who might otherwise have been laid off, as our commercial offices and some luxury rental buildings were vacant during the spring and summer. We navigated what the ground rules would be in terms of bumping when it wasn't clear how long layoffs were going to last, or there wasn't finality in terms of what the layoffs would be as buildings were winding down, winding up, staffing needs were changing. And as we reached the winter and we're looking forward to the reopening this summer and fall, once the vaccine was widely distributed, we negotiated with the industry extended recall rights. Normally recall rights for our laid off cleaners are 6 months, and we extended them through October 1st of 2021. And those were for cleaners who were laid off primarily between March of 2020 through the summer of last year. So we've had a very high-level partnership with the industry. That partnership then informed our advocacy and our work and collaboration with other independent employers. We had a collaboration with the Broadway League as well as with the other Broadway unions regarding the wind down, last March in terms of both health benefits initially being continued while the 32BJ Health Fund trustees implemented the additional continuation. And now we're working with the Broadway League and other major cultural employers on their reopening process, and about 1,500 to 2,000 members who will go back to work this summer and fall as performances resume. So we're very excited about that. And then with our security employers, who are all primarily contractors working for tenants and owners, we negotiated an initial memorandum last spring, again providing for extended recall rights, trying to navigate the guidelines and the incredible demand for PPE when there was a shortage throughout the spring. And then again, those members as well benefited from the health benefits continuation. Our security jobs, as reopening began last fall, came back online more quickly because the COVID protocols for screening as visitors and tenants enter office buildings actually required positions to come back online fairly quickly. So at this point, we still have several thousand members who are on layoff. The numbers are ticking up in terms of recall every week, and we are hoping that as the city returns to work coming out of Labor Day, that the vast majority of all laid off members will be going back to work.
Well, Elizabeth, don't spoil our fall programming, because I think we're going to have a lot of LERA programming in the fall about how to deal with all of the challenges that reopening is going to bring. I just want to get to a few more topics because we're real short on time right now. But there's one topic that I don't think.
Rory, can I just make one point?
Oh, sure, Kim. I'm sorry. Go ahead.
Because Elizabeth brought it up. I want to say that although our ridership was next to nothing during especially at the beginning of the pandemic, and we had a lot of financial challenges, we did not lay off one employee during the pandemic. So that's something that the MTA is proud of.
Yeah, I can tell you from the that's incredible. I can tell you from the nursing industry, we had a really interesting situation where we had a very, very severe shortage downstate where COVID hit very hard. And then we had no work for people upstate, and there were hospitals that furloughed people because there were very few COVID cases, but everyone was afraid to go to the hospital for things they normally would. So we were juggling both both ends of things. But the one topic that I don't want to let the night pass without mentioning is the racial justice movement, which arose in the wake of the murder of George Floyd. I think for all of us is just so intertwined with the pandemic, and also with our experience of labor relations. So I wanted each of you, if you can, to please talk a little bit about how the racial justice movement affected both your employee and labor relations matters during this last year, and how those things may have changed for the future.
Is Elizabeth's on, or maybe she got cut off?
Oh, Elizabeth, Meg.
No, I'm still here.
Oh, okay.
I'm sorry. Would you like? I'm not sure you'd like to go first, Rory.
You, Elizabeth, since you're talking.
Okay. So 32BJ has a very long-standing and progressive racial justice campaign. Racial and economic justice have been the basis of our organizing programs, particularly our security organizing program and our airports and fast food organizing. I think many on this call are familiar with. This was a cornerstone of our bargaining program as well, and employer relations prior to COVID-19 and the pandemic, and the national awakening or recognition of racial injustice and racially disparate policing practices. So I would say what's happened in the pandemic, has heightened our advocacy and our awareness. I mean, certainly the impact of the pandemic on Black and Brown communities, was experienced head on by our membership. We had, our members were not only on the front lines in terms of, keeping New York as safe as possible during the pandemic, and keeping tenants and guests and people who were working in essential businesses safe during, while they were working. But our members live in communities that were very hard hit, by COVID-19, and our membership in New York suffered a significant number of losses. So, it is something that informed everything that we did, from our advocacy for PPE to our advocacy at the state level to ensure that our members were recognized as essential workers, and that our advocacy on their behalf for vaccine access. And Local 32BJ has had a very aggressive policy and legislative campaign regarding, not only police reform, but also voting rights, including ranked choice voting. And other mechanisms in charter revision and other legislative programs to ensure that communities of color and low-income and working-class New Yorkers actually, reap the benefits of our democratic community and democratic processes. So we have a social justice leadership academy within our membership. They are very active on racial justice issues, as well as workers' rights issues, immigrants' rights issues. And so, that too has been a significant vehicle for our membership to be engaged and mobilized. And last year, at the height of the demonstrations in June and July, June 15th is Justice for Janitors Day nationally, and Local 32BJ, used that opportunity, our citywide organizing and our organizing with the other SEIU locals across the country, to focus on racial justice and the Black Lives Matter movement.
And Kim, how did the racial justice movement affect labor relations for transit?
So, let me, apart from the other agencies at MTA, New York City Transit's employee makeup is predominantly people of of color, Black and brown people. And we acknowledge that in many ways, but I want to say during the pandemic and in the wake of the George Floyd movement, you know, we were one of the prioritized organizations for vaccinations. We made sure that we had targeted vaccination information and learning toward our groups of employees who are frontline facing, who again are predominantly Black and brown people. We made sure that our folks were vaccinated first, that they understood the importance. We are now vaccinating actually their families. After we did the first round of NEC, we've opened it up so that our folks and their families can be vaccinated. But in specifically to the George Floyd movement, we did a series of town halls, conducted a series of town halls in conjunction with the Conference of Minority Transportation Officers, to just have a space for people to talk and express what their feelings are. We also have come to the realization while the majority of our employees, frontline facing employees are people of color, that we have issues within the management ranks. And we are now currently dealing with those issues as well. We don't have enough representation of people of color in the management ranks so that it would be representative to those people who are on the front lines. So there's been a lot of conversation about racial justice and what it means to this organization. But those are just a couple of things, and I know that we're running short on time, so I'm not going to go on too much more about that.
No, thank you, Kim. So yeah, we've hit the 7 o'clock hour as we anticipated. We probably should have allotted more time for this conversation because there's just so much material that we could cover. There's so much ground to cover. But I'd like to ask each of you to, in conclusion, just to give your thoughts about any joint efforts that you were a part of with labor and management or employees and management, and what you think this whole experience of the pandemic means for the future of labor relations. What are your takeaways? So Kim, why don't you go first?
Okay, so I was a part of all of those discussions that we outlined earlier with our labor partners. I feel that I always have had a good relationship with our labor partners. We have our ups and we have our downs. That's labor relations, right? We don't agree on everything. But we were able, with me and my team, and I see one of my team members is on tonight, Lenny Axelrod, we were able to build stronger relationships. I think that we, and I hope that they last past the pandemic, but I think that we have established a level of trust. We were met with a once in a lifetime, I hope, situation. And as an employer, no, we were not perfect. But I think that we did things to make it clear to our employees that we do care. Again, there were no layoffs. We, tried to do PPE, vaccinations, additional time, administrative leave. One thing that we didn't get to talk to about, which is an unfortunate thing, we had 168 of our employees die of COVID-19. Although we did not negotiate hazard pay, we did have a COVID-19 death benefit for all of our employees who not necessarily contracted the COVID disease here, but who died of COVID. Their families received an additional $500,000 in compensation. So, I mean, it's money, of course, can't replace your loved one, but there was some thought given to the situation and how it would affect individuals, and hopefully the trust that has been established with the unions, which was some of the reason why I was able to push some of the things so quickly without truly negotiating, will last past this point in time.
Wow, thanks. And Elizabeth.
Yes, want to echo Kim's point that I do think the pandemic required both sides of the table to not just, bargain with one another, but to actually think on our feet and think, in partnership about how to lead through the crisis and, what were the day-to-day needs and how are we, taking our historic relationships, the trust that we had, from longstanding, mature collective bargaining relationships, and principles that kind of underlie our contracts and the various sectors of our industry to respond in a way that was transparent and fair and nimble. With our industry partners, we were on the phone sometimes daily, starting every day with long conference calls with industry leaders to talk about, what was happening and then to figure out how we were going to respond, and then replicating, that type of structure of coordination, throughout our sectors with our, whether it was theater and cultural, residential, commercial, security. And, we'd had, unfortunately, we'd had the experience of having to respond to September 11th. 32BJ lost many members when the World Trade Center was attacked. And so we had that experience of very rapidly having to work with the industry under very onerous circumstances to respond to mass displacement as well as, loss of life. This was a bit different. The nature of this crisis was different. And we were fortunate, though, that the leadership on both sides, with the Realty Advisory Board and 32BJ had both been involved in the September 11th response. And so we had that experience of working together quickly to respond and, communicate broadly, certain principles that were going to guide the industry and provide stability to our members in a time of crisis. So we had the benefit of technology this time around. And, we certainly pioneered how to use Zoom and, in addition to conference calls in order to, get things done. And, as we're going to reopening, we're using those same tools right now. We're looking at, how to promote the vaccination of all our members, working with the city to have mobile vans go out to our largest work sites, promoting education about the vaccine jointly. We're working right now on implementation of the HEROES Act. And as we go into the fall, we're going to work together and continue to work together to implement the agreements we've already negotiated regarding recall. But I'm sure there are going to be, many curveballs, coming our way that we'll have to respond to as we get into the fall months. So, we've built on these historic partnerships, but adapted. Based on that trust and that experience, adapted to the current crises and, tried to be nimble, responding to things, day to day, week to week, as the situation has rapidly evolved.
Okay, so I think now that we're run a little bit over time, I'd like to conclude the program. This is my last program as president of the local chapter, so I'd like to thank all of you for your participation. So many of you have been repeated participants and virtual attendees. I can't wait to see all of you again. And I just want to share my own reflections on my experience of the pandemic, not here at LERA, but at work. I found that in labor management relations in general, I think a lot of people abandon the kinds of pettiness that sometimes we could get caught up in. I think that people largely jettison those things. We're sitting here in our own homes. We have windows into other people's little square windows like this into the lives of people that we might not otherwise have had. And I think there was a greater recognition on all sides that that everybody was dealing with similar with their own stresses, similar stresses. And I think that hard as this year was, and despite after all the losses that we endured, I am optimistic that we're all going to come away stronger and better for it. So I thank all of you again for your participation and support. I encourage you to continue to be active in LERA. I look forward to being active myself next year, and I wish you a good night and a wonderful summer.
So,